I'm Dr. Kyle Shunkwiler. I'm the founder of SpineandSports Chiropractic. I live here in Lincoln with my wife and my 3 daughters and my son. So when someone asked me how did I ever get interested in doing what I do, it was I got hurt a lot growing up. Played a lot of sports, I got a lot of injuries. So I found that chiropractic was very helpful when I got injured with a joint. So I decided real early on I wanted to be a chiropractor. And then I got injured playing baseball, and then physical therapy helped me a whole bunch. And so I was like, I might want to do both. And then I came across this thing called ART and learning how to lengthen and strengthen muscles. And so I ended up going to 4 different schools over a course of about 10.5 years. So my wife teases me that I'm a little bit of a nerd that way, but I think it's been great for treating patients, because whether you have a joint injury or you have a muscle that needs lengthened, a nerve that's stuck between muscles, I'm able to peel them apart. And then if you get hurt and you have some sort of post-surgical rehab, that's what my master's degree is in. So I know a lot of people don't get to say that they love their job, but I actually really enjoy what I do. I've gotten asked quite a few times what I like about my job, and I like puzzles. I really like to watch people move. Like, my wife gets annoyed because if we're at the airport, I watch people walk and I'm like, so is that person at left knee pain or right knee pain? She's like, I'm not one of your students, don't quiz me. So I love mechanics. Like, I like to take things apart and put them back together. I'm kind of a little bit of a tinker-toyer. So this is a perfect job for myself, and I look at everyone who comes in here the same way. They're a set of unique problems, and a lot of time they're multiple problems. So they'll give me all these symptoms, but instead of just being one injury, it's actually like a series of injuries is compounded on top of each other. So instead of looking at them this way, you have to really look at them as in layers. And I love that part. It gets me excited to treat folks. When it comes to injuries, when people come in, I think there's 3 big areas that we really need to look at. The first one is we need to control inflammation and swelling. The second one, I try to really attack lengthening tissues, whether that's a nerve that's being pinched between muscles or at the spine, just tissue glide in general. And the third one is to strength train those tissues to get your stability back. So like inflammation, then we go after mobility, and then stability. And that's really how I look at all my problems, and when I go into treatment on how to get them all the way better. The things that I really like to treat and practice, I would say shoulder injuries. Like, I was a baseball player growing up. I worked and did 2 residencies for 2 colleges in St. Louis. When I was there, I worked for Velocity, where you train athletes to run faster and jump higher. So I love sports injuries. Shoulders are real tough for a lot of folks, and I like the challenge of those. My master's thesis was foot and ankle injuries. So when it comes to feet, I know that's a weird thing for some folks, but I actually really enjoy working on feet. So growing up, I thought that I was going to either be a pediatrician because I love little kids, or I thought maybe I'd go into orthopedics, where you get to actually, put new parts inside people. However, after I cut my hand one day and I was bleeding, it wasn't even that big of a cut. I got really lightheaded and woozy and remember having to sit down, so I thought probably surgery was not going to be in the cards for me later on in life. So we may not be here at SpineandSports putting people back together in the sense of surgeries. However, we can return a lot of people to their daily lives and their activities that they love to do. So in essence, we are saving lifestyles.